Infants' restless sleep. Why can a baby whine, cry, and complain during sleep? Being in constant motion? Well, that is the question I will answer in this video, but before I begin, let me introduce myself. I am Dr-Silva, pediatric osteopath and founder of Dr-Silva.com. Now let's cut the waffling and get to the heart of the action. Why can an infant's sleep, and I'm talking about first 0-3 months, and then I'll digress into baby's 3-6 months sleep, be agitated? Why can a baby whine, complain, and maybe constantly move around? Well, in the first 3 months, you have to know that the infant is a very simple being. When, well, from a psychophysical point of view, the baby should have a sleep-wake rhythm. Good, if not optimal, and also be well during the day, thus not suffering from gastrointestinal disturbances or particular irritability. When this does not happen, it can lead to difficulties both during the day and during sleep. Let me explain further. For example, when a child starts suffering from mild gastrointestinal disorders, or rather gastrointestinal disorders in general, from the mildest dyschezia to constipation to colic, or from digestive difficulty to regurgitation to reflux. Well, when your child suffers from these gastrointestinal disorders, not only do you suffer from them during the day, and so you see them with the various symptoms related to them, but also during the night, a child, especially in cases where they are medium, you might see him or her constantly agitated. Maybe he struggles to get to sleep, or if he does get to sleep, he keeps being on the go. Maybe you feel that he's gasping for air. You see that he's moving his legs completely. Maybe he's doing some regurgitation, or you have to pick him up and he keeps burping or having slow management even after minutes, after tens of minutes during the cupping. Well, in these cases, the solution lies in resolving the gastrointestinal disturbances, because remember, they are not physiological, they are the result, or rather they are the symptom of an irritated and inflamed gastrointestinal tract. And I'll leave you on my website Dr-Silva.com the whole part of explanation, scientific studies, and also a whole video course affixed on their treatment. And as a result, then the child will begin to improve both his well-being during the day, but also to have less restless and more restorative sleep. Hand in hand of the other things to pay attention to are possibly if the child has contractures, stiffnesses in the neck and back, caused by intrauterine malposition or the type of birth. For example, a baby who has been all crooked a little bit inside in the mother's belly, who has had a difficult delivery, coming out with the adventurous, a long, very rushed delivery, may develop these contractures, and when lying down, maybe it's those babies who keep turning their little head from right to left, who only sleep on their side or on their stomach because the whole back is bothering them and they have a hard time staying supine. This is another case of, how shall we say, agitated sleep difficulty. Another factor that I want to talk to you about, but here we get more into the issue of babies from 2-3 months old onwards, is a matter of gums. Let me explain more. Let's take the example of a baby who has always been quiet, who has had a good sleep-wake rhythm, and around the 2nd or 3rd month starts to being more agitated during sleep, waking up several times, wanting to feed several times, but already after half an hour, after an hour or so, he wakes up, has to be picked up to feed and falls back to sleep and so on. Sometimes it happens more easily from 3-4 onwards in the morning, sometimes a little bit in general during the night. Very often one says to oneself, but what is it? What has happened to my baby? Is it a sleep regression? So if we want to call it that, then my fellow sleep consultant, sleep could disquisition it, but what really happens is that very often the baby's teething starts to move, or rather, the baby's first 2 little teeth, but also the 2 upper incisors, which are supposed to come out around 5-6 months. It's not like they come out in the 5th month and they do in 2 seconds, in 1 week, but around the 2nd and 3rd month they start moving. And of course the little tooth cuts the gingiva here, which is in the 2nd and 3rd month, it cuts it here, which is in the 4th or 5th month, and it cuts it all the more here, which is in the 5th, 6th, 7th month. So already around the 2nd and 3rd month, you might see the baby salivating more, putting his hands in his mouth more, being more mumbly during the day, coming off the breast more easily, chewing on anything, and waking up at night and having a more restless sleep. Well, in this case, they could be the beginning of teething, which will have a long course, however, obviously a physiological beginning of discomfort and restless sleep, not dictated by gastrointestinal disturbances or any contractures, but a more physiological speech dictated perhaps to the teething part. Well, what can I say? Thank you very much for staying with me. I recommend you to visit me at Dr-Silva.com, where you will find dozens of video courses to promote the best development of mother and child from pregnancy to the early years of life, and see you in the next video. Bye.